Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone. Thank you for joining me on tonight's Egg Whisperer Show. The topic of tonight's presentation is, when is it time to see a fertility expert? Being a fertility patient is not easy. No one gets married and then says, oh my goodness, I cannot wait to meet Dr. Amy. I don't think that's ever been said at an altar, but certainly I do everything possible to try and make the experience as easy as possible for my patients. So first of all, before you can find out when it's time to see a fertility expert, a lot of people actually don't know what a fertility expert is. That there are people like me who've studied a really, really long time to figure out that an egg and a sperm make a baby. So basically what a fertility expert is someone who went to medical school and then did training in OBGYN. And then after an OBGYN residency, did extra training in a fellowship called Reproductive Endocrinology and Infertility. So docs like me are called REI doctors. That also makes us fertility experts, fertility specialists. So like my sister says, you went to school a really long time to figure out that an egg and sperm make a baby. Good job. But I actually think that a lot of training is needed because you have to understand the complex problems that women can have related to their uterus, their fallopian tubes, their ovaries, and understand the medical problems that people can have going into a pregnancy. So without that kind of training, doing fertility medicine wouldn't be, you wouldn't be as good of a doctor and be as well-rounded. So first of all, when it's time to see a fertility expert, how do you really know? And so I bring up this picture because, number one, a vacation would be really nice right now, wouldn't it? There's so much going on in the world, but I bring up this picture to point out one thing, that when you plan a vacation, you've heard me say this before, you lay out all the maps in front of you, and now with everything that's online, you're not literally laying out maps, you're just going online and doing research, but you're also going to a tourism clinic or an infectious disease doctor to ask about the different vaccines that you might need. So when you're planning a family, you want to do the same thing. Approach family planning the way you would do a vacation or your future retirement. Lay everything out, get your levels checked, figure out what's going on before you get on that trip. Don't start the trip and say, oh my goodness, I had diabetes. I had no idea I knew it until I got pregnant. And certainly when you're pregnant, that's not necessarily the time that you want to be dealing with a complication from a medical condition. Finding out about the medical condition earlier on would have been the best thing to do. So in order to know if you should see a fertility expert, understanding a little bit about human biology is definitely necessary. My job, not rocket science. It takes 3 things to have a baby, and I know I'm making it very simple, and I'm making it sound simple, and I know it isn't as simple as I'm making it sound, but from a higher level to a lower level, basically it takes 3 things to have a baby. Fallopian tubes that are open, sperm that's swimming, and ovaries that are working. Certainly, it's not just about that. But when we talk about things that, for example, are related to ovaries, a lot of people think about the biological clock. So if, for example, you're someone who has had surgery at a younger age to remove an ovary, let's say you have a history of endometriosis, these things can affect your eggs. And we're born with all the eggs that we'll ever have, and we lose them over time. So for example, a woman has the healthiest eggs that she'll have in her 20s. When her 30s, the eggs, I don't like to use words like deteriorate, I don't like to use negative words, but basically the eggs that we have closer to the end of our fertile, or as our fertile window is closing, they tend to not be as healthy as eggs that we had earlier. So there are things that you can do, things that you could check to see what your egg health is like. So do you have to wait to find out these things? No. In general, what the textbooks say is that if you're someone who's been trying for at least 1 year, under the age of 35, that's a good time to see a fertility expert. If you're over the age of 35, you don't necessarily have to wait an entire year. Try for maybe 6 months and then see a fertility expert. But obviously, I'm biased. I don't think that there should be a reason why you have to have an indication to see one. If you're planning your vacation, just like you're planning your family, right? Take the time, see someone, get levels checked before you start on your journey. That's kind of the message that I'm trying to spread to everybody so people can become more fertility aware and reach their family size goals so that they don't look back and say, gosh darn it, why didn't I watch that Egg Whisperer show and listen to Dr. Amy? So that's basically the biological clock, right? When I think about the clock, and I hate thinking about the clock, we also think about eggs and ovaries and what might affect them. So if you have a history of any of those things that I mentioned, like endometriosis, having an ovary removed, certainly, or even irregular periods or cycles that might be a symptom of PCOS, certainly seeing a doctor sooner than later would be great. There's no need to wait. So now, fallopian tubes, and you're probably wondering, why do I have a photo of a freeway system? Well, I call the fallopian tubes the embryo transport system, right? So the egg and sperm, let's see if I can do this. They meet in the fallopian tube, and then the fallopian tube is responsible. I clearly don't make a good weather girl. I'll keep my day job. So basically the egg and sperm meet in the fallopian tube, and the embryo basically travels down the fallopian tube or the embryo transport system from one city to the other. And when it comes to your body, it's basically from the side of the ovary into the uterus. It takes about 3 days to do that. After about 5 days, that embryo is inside your uterus and it's gonna snuggle up and hopefully hatch and attach. So when would you see a fertility expert? Well, if you have a history of chlamydia or gonorrhea or any type of sexually transmitted infection, or even endometriosis, all of these things can affect the embryo transport system. It can make a major collision or breakdown inside that fallopian tube. And there's some websites that are out there that I've seen that people read and they say, no, Dr. Amy, I read that you can actually do surgery if your fallopian tubes are blocked. And I wish it was something like a construction zone on a freeway that, you just go in, you clean it up, and you go back, and then the freeway is moving back and forth. But there's something about the inflammation that happens in a fallopian tube. We haven't figured out a way to kind of clean it up so that the fallopian tube is back to normal. So there are certain situations, but they're rare, where you can actually clean up a fallopian tube blockage. But that kind of scenario is very uncommon. So IVF was actually invented for women with blocked fallopian tubes. But how would you even know if you had a blocked fallopian tube unless you saw a fertility expert? So getting a procedure called a hysterosalpingogram. Hystero stands for uterus, salpingo, tube, gram, photo or picture of. You get that picture done and you can get a really nice image of what's going on with your fallopian tubes. If one is blocked, if one is dilated, the term that we use there is called a hydrosalpinx. Then your doctor will talk to you about what to do next, and maybe if you're a candidate for IVF, do IVF, but there certainly aren't other ways to help a woman ovulate from the open side. And I have patients that come to me, I hear this all the time, so if you're one of those people that thinks this, you are not alone. I have patients that come in and say, Dr. Amy, I ovulate every odd month on the right ovary. And I say, that's not how ovaries work. You actually don't alternate ovulation right, left, right, left, right, left. You could ovulate left, 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 right, left, 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 right, 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 left. Get it? See, it should be a song. So now the swimmers, right? The sperm. So you have the sperm are flying in the studio, people. There we go. So when it comes to the little swimmers, this is a girl sperm. This is an X sperm, and this is a Y sperm. One day, two sperm will be able to make a baby, people. One day, but not today. So as far as the swimmers, so what kind of conditions can cause low sperm count? So if you're a guy and you're wondering, is it time for me to see a fertility expert? Well, maybe something like if you have a history of an undescended testicle, any type of testicular trauma, torsion, twisting, anything like that, maybe a hernia repair, these things may contribute to a lower sperm count. Maybe you had a brother, another family member that had a harder time conceiving. Maybe your dad had to go through IVF, and maybe he'll share with you that it was for low sperm. Those kinds of things are things that say, maybe I shouldn't wait for that 6-month or 1-year rule. Maybe I should do a simple check-in. And there are home semen analysis tests that you can do. There's a home collection kit from a company. It gets sent to your home. It's a temperature-controlled kit. You produce a sample, you ship it off, and you'll find out how fast your swimmers are swimming. And then you can decide whether you need to do additional treatment or get extra help from someone like me to get those swimmers moving up to the embryo transport system, which is the fallopian tube, to get a baby in your uterus. So that's always the goal. So people sometimes say to me, Amy, why do you do this show? Because Like, don't you want patients? Don't you want to see more people? And my thing is, no, I want to educate people about what they can do for themselves, how they can empower themselves so that they can actually get pregnant where it's way more romantic. My office, if you've ever been there, is not sexy. It is not romantic. So the next thing about when it's time to see a fertility expert, or how you know, is the home. And the home, when it comes to pregnancy, is the uterus. So what kinds of things might a woman have that might make her want to go see a fertility expert sooner than later? So here are some of the things. Well, if you're spotting in between your periods, that could be a sign of a uterine polyp or fibroid. How about having really heavy periods? Well, that could also be a sign of a condition called adenomyosis, which is associated with endometriosis or fibroids, and also polyps. So what about scant periods or really, really light periods? Well, in someone who may have had a procedure called a DNC, that could be a sign of something called Asherman's syndrome. So rather than sitting at home and waiting to find out if you're going to have a pregnancy sooner than later, if I mention anything that kind of rings a bell and you think, well, maybe that's something that I've been through, well, I think it might be time to see a fertility expert, and don't delay. Because I think a lot of people, they sit at home and they worry that there's no hope for them, there's no help that someone can provide them. And the thing is, there definitely is. All the things that I mentioned to you, there is a fix, there is a solution. A fertility doctor like myself does have the tool in their toolbox to help any of the conditions that I just kind of brought up right now. So the next thing I want to talk about or transition to is what happens in the first visit, what to expect. I get this call all the time to my office where people call in and say, well, what's going to happen? What's going to happen the first time I meet Dr. Amy? Well, the first thing that's going to happen is I'm going to sit down and I'm going to ask you, what do you think is going on? And people often look at me and like, well, I came here to find out what you think. Well, this is the thing. People know their bodies. They kind of have a sense as to what might be wrong. And I find if I really listen to that, a lot of patients are right. I'll still do all the diagnostic testing. I'll still review everything. But I really feel it's important to listen to people and what their gut is telling them. Because even if they don't know the whole story when people come in, oftentimes they know just enough so that I can really not miss a single thing. So the first thing to expect is when you come in, you will learn more about fertility and get answers to specific questions you may have. You notice I did not use the word infertility. I believe all my patients are fertile when they walk in. Everyone has a future family coming their way. It may not be the way they originally envisioned, because I can't necessarily help everyone the way they originally thought, but I do think that there are a lot of different ways to help a family grow. The other thing that will happen is I'll talk about your fertility history, everything that you've been through. I'll talk about what cycles you were on, how you felt on the medications, how many follicles you ovulated, whether you did a trigger shot, the timing of the trigger shot, the thickness of your lining, when the IUI was performed, how you felt going through that process, whether you had any side effects to those medications. So all of those things are really important to me. So those are the things that I want to know. The other thing that we'll do is review your medical, surgical, and family histories. I will want to know when your mom went through menopause, when your sister stopped having her periods, if you have a sister, if any of your sisters had IVF, and then if your dad on his side of the family, if there were any issues there. Believe it or not, we have genetic variants that come from both sides of the family, both from mom and dad. And you can't look at your dad and be like, Dad, when did you go through menopause? How many miscarriages did you have? Because obviously guys don't know. But I think there's this thought out there that your fertility is only related to what's going on with your mom or what happened with your mom, but it's not. It's both maternal and paternal on both sides of the family. So the next thing that we're going to do when you're in my office is talk about all the medications that you're on, and I want to know everything. I want to know the cold medication. I want to know, whether you're taking Advil for your pain around ovulation, because sometimes those kinds of things can interfere. I want to know about the Chinese herbs that you're taking, because there are some herbs that may not necessarily be good for you at a certain point in your cycle. I have an herbalist that works in my office. She's actually my PA with a special degree in Chinese medicine. So if I can't read a bottle because I don't read Chinese, she certainly can figure out exactly what it is you're taking and why, and whether it's something that's good for you in this cycle or not. The other thing that would be helpful is write a list of everything that you're taking with the exact doses. For example, I love lists, and most people know when they come see me that I love that. So they'll come and they'll bring a list, for example, of their supplements, and they'll say, CoQ10, I'm taking 200 milligrams, DHEA, I'm taking 50 milligrams, vitamin D, I'm taking 4. And then that will give me an opportunity to look at that list and say, okay, let's change the CoQ10, go up to 600. Why don't we add something like acai berry? Why don't we add something like melatonin? Oh, you're taking DHEA, but it looks like your testosterone is high. I'm glad you told me. Let's stop taking the DHEA. So without that list, I wouldn't be able to tell people exactly what to do things differently to help them. So it's really important. I have patients that sometimes even bring a big bag. They bring a bag of all their supplements, and I think that's great. We put them out all on my table, and I review them, and I tell them exactly what I think. The other thing that we're going to do is discuss your family size goals. I know what you're going through is hard. It's really, 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 really hard. I go through it every day, all day long with my patients, and all night. And I know by the time a patient sees me, they look at me and they say, Amy, at this point, I'd be happy with at least one pregnancy. But I'm a greedy person. I'm just very greedy. I want people to reach their goals, and I want them to reach their family size goals. So for me, when I talk to you about how many kids do you want, it's because I really want to help you have that family size. And I'll give you a scenario. So let's say we get pregnant with IUI and the sperm was sort of, so-so, but we were successful. Well, if I knew that you wanted 2 kids, guess what I'm going to do? We're going to order a sperm freeze for you. So that in 2 years when you come back to me, and people do. I've been around for almost, I would say 9 years now in my practice. I have patients that I've helped have 3 kids so far. 3. And I have a patient who's almost on number 4 with embryos that I froze prior to 2010. So that's really, really special. So I'm thinking big picture. I'm thinking, what can I do today to help you 8-10 years from now? Not just for this pregnancy. So that's the reason why I want to know what your family size goals are. So the other thing to expect is reviewing options for genetic testing. So I tell people, look, we should screen you for diseases like cystic fibrosis. And the first thing people say to me is, Amy, there's no one in my family with cystic fibrosis. And I say, I know, that's usually what happens. Most people don't know that they have cystic fibrosis in their family until 2 people come together that are both carriers for this disease. So talk to your doctor, and most of us bring it up, but if they didn't bring it up, talk to them about what these tests are. And then if you have more questions, don't feel rushed to do them. Do a pre-test counseling appointment. Most of the companies that offer these tests, they offer that. Talk to a geneticist, get your questions answered, and make sure they're answers so you feel like you've declined treatment for the right reasons, but you've also opted into treatment for the right reasons. And don't think if, let's say, you're a carrier for cystic fibrosis or a disease like that, that for some reason you have a disease. Being a carrier only means that you have the chance to pass a disease on, and that's a chance to pass it on if your partner is a carrier too. So it takes both of you for diseases that are autosomal recessive to pass it on to your baby or offspring. So the other thing that I want people to do is bring their lab work. I think of myself as I make puzzles every day, all day long. I'm basically a puzzle maker. I don't know if there's a profession, but maybe I should change my name to professional puzzle maker. So when people come to me, especially for the first time, they're bringing me little puzzle pieces. They're bringing me their, tube test results. They're bringing me the semen analysis. They're bringing me the FSH estradiol, and I'm kind of putting everything into this beautiful picture. That is your fertility story. And I want that story, and I want people to leave my office from that first visit with a full picture of what their story is, so that I can describe to them what pregnancy rates they have for the different treatments based on the diagnosis and what we've learned about them. So if you haven't done any of the tests, like the lab work, and we'll talk about what lab work I'm referring to in a moment, but if you haven't done any of those tests, it's no big deal. So if you call my office and you haven't done them, my office will simply coordinate it for you, so that when you come into the first visit, we definitely have the information about your fertility levels so that your visit is as efficient as possible. So you're not leaving wondering, I wonder what my levels are, I wonder what they mean. And the other thing that's important to do is talk about how much each treatment option costs. And I think looking at that relative to the pregnancy rate is also really important. Because I have patients that say to me, well, IUI is much, much cheaper. I'm going to do 3 to 6 IUIs before I do IVF. But let's say your diagnosis is that the sperm's not swimming as fast. Well, perhaps doing IUI may not be the best use of your time and energy because the pregnancy rate for IUI is very low. So make sure you understand what the diagnosis is, what the treatment recommendations are, and why before you do them, so that you're not wasting your well-earned money and wasting precious time on treatments that may not be successful. So this is one thing that I will one day have in my office, a cupcake ATM. I've seen wine ATMs, cupcake ATMs. One day I have a dream that I'm going to have something lovely, fabulous, or maybe my crotchless pants kiosk, something like that, that will bring a smile to people's face when they come in my office. So there are tests that we also do during the consultation. So at this point, you're probably saying, am I at Amy's office all day long? No, I talk this fast during my appointments too. So I can be efficient, I can be quick. The appointment is about 60 to 80 minutes, so we can accomplish a lot in that period of time. So when it comes to testing, what we're going to do is I'm going to take a tour of your pelvis. I bet you've never, ever heard anyone say that before. That's basically what happens, and that's the beauty of a pelvic ultrasound. So if you've never had a pap smear before, most people have, but basically the probe goes in the vagina just like a speculum, and then we look up on a screen and we can actually see the uterus, the contour, shape, size. We can see if there are fibroids. Sometimes we can see if there are polyps. We can see if there are dilations in the fallopian tubes, that they're very, very obvious, and we can also count the number of follicles that are in the ovary, and that's called antral follicle count. So I can put that together for a patient and give them an idea as to what their fertility is like, even if they haven't brought in their FSH, estradiol, or had a chance to do their fertility hormones yet. So we can also look at the ovaries and see if there's a sign of something called endometriosis, and then look and see if there are any type of ovarian cysts. So we can get a pretty good idea as far as what's going on, especially if, let's say, there's a structural issue with the uterus, so that when you leave the office, you know that you're going to have a plan. If you need extra follow-up, extra imaging, you're going to have a plan and referrals to the proper imaging centers for that. So I mentioned blood work and how important it is to have some of those puzzle pieces when you come in, so that I can give you an idea as to what your fertility levels are. So you can actually do a lot of the blood work in the office. So let's say a patient had blood work 6 months ago. Well, I can draw your blood in the office, and then we can send it off for an AMH, which is anti-Mullerian hormone. I describe it as a sperm count for women. You can kind of get an idea as to how many eggs a woman has. It's not that accurate, but it gives us a good idea as to what's going on with the ovarian reserve or number of eggs a woman has. And then we put that together with the FSH and estradiol. That's done cycle days 1 through 4, and those levels all together kind of tell us what's going on. We also like to do other tests like TSH, which is thyroid. An elevated thyroid or a lower thyroid can affect the quality of your ovulation. And the fetus relies on the maternal thyroid gland through the first trimester. So that's why it's so important to make sure that these types of hormones are okay before you plan or start a pregnancy. And we also check things like prolactin, vitamin D, your immunizations. So if you're at my office, you can get your blood drawn at your first visit, or we just put a referral form or an order form into the Quest Diagnostics system, and you can go to any Quest Diagnostics at your convenience if that's the lab that your insurance requires you to use, so that you can get your labs drawn as soon as possible. The results come right to me, and then we can do a phone call afterwards to review the results. So guys, and we love it when it's a mommy-daddy couple. Guys sometimes are scared. They're scared that I'm going to all of a sudden be like, it's time to do a semen analysis. You're on. And the answer is no. No guy ever does a semen analysis at their first visit. I know there are lots of movies, lots of shows about fertility, and it seems like sometimes that happens, but it doesn't happen in the fertility doctor's office. It does, especially not the first visit. So we often talk about the sperm, what extra testing we want to do. You might leave with a home collection kit. There's certain DNA tests that you can do that way, and then always order extra tests if it seems like it's needed. Sometimes I do check the hormones of a guy, like their testosterone, depending on what's going on and what their story is. So I talked about the embryo transport system earlier and getting a tubal evaluation, and sometimes I do that in the office. For example, today I had a new patient. I looked and I saw in the middle of her cavity was a cute little fibroid, and it was about 7 millimeters, and I just wanted to confirm whether it was impacting her fertility or not, and really inside the uterus. So right then and there, I asked her if I could do a saline sonogram, and we did that, and it looked like a little portion of it is in the uterus. So we'll be getting a hysteroscopy for that fibroid very, very soon. So without doing a pelvic ultrasound, Who would have known after 2 years of trying that that was actually in there? So it's really important to get these kinds of tests done. And I do sometimes get the call from patients that say, I'm a fertility patient. I've been a patient. I've been a patient for 2 years. Why does Dr. Amy have to do another ultrasound? And I can tell you that there's just sometimes just having someone else take a look at something, they can see things that maybe other people, it's not that they miss, maybe things change over time. So maybe you haven't done a check-in for a year. Getting another pelvic ultrasound can just inform your doctor in a way that an old ultrasound just can't be used that way. So it's important to just do testing, repeat them if it's been a while, just to make sure that they're current so that your doctor always knows everything about you all the time. So the semen analysis, there's so many different ways that you can do it. Well, there's just one way you can do it. Legally, I should say. So there are so many ways that you can do it, but basically, that was supposed to be a joke. I'm not a comedian. That was a really, I know. People are throwing sperm at me. But basically, I talk like this every day, all day, the minute I wake up till the minute I go to bed. This show is no different. So basically, like I said earlier, you can do a home collection kit, or you can go to the lab and you can collect in the lab. They have collection rooms there, obviously, that are private. You can also collect at home and bring the sample in if you live 45 minutes or so from the lab. And I use the term flow and go because people always ask me, can I collect the night before? Can I put it in the freezer? Can I put it in the fridge? And the answer is no. Sperm like to be warm, so you flow and go, put it in the cup, get it in your little sperm snuggie. One day I will invent one, spermsnuggie.com. I'm going to GoDaddy right now to see if it's available. But typically semen analysis results, say that 5 times, please don't, take about 3 to 5 days to result. So once we get the results, we talk about what can we do to make the sperm even better? Are you in IUI range? If you are planning an IVF cycle, should you consider ICSI? Should you consider PICSI, and what other advanced sperm tests you can do? So much to talk about when it comes to sperm. I could talk about this all day long. So I'm doing that just as a check-in to say, relax. I got sent this really cool link about how to relax and be stress-free for 60 seconds. I'll post it here in a second. But basically, one of the things that I like people to do is bring a friend. Bring another person. I do have moms and dads that come. I do have sisters. I have brothers. I have best friends. So it is not weird for me for when patients come to see me at their first visit to bring a fertility friend, a buddy, a family member, someone to be there for you. This process is so isolating. It's really, really nice to just have another person there with you, listening to the same information. And then the other thing is just bring a pad of paper. Bring a notebook with a pen, so that as the doctor is talking, you're writing things down, so that if you don't have questions right then, that's okay. You go home, you talk to your partner, you talk to your therapist, you talk to your mom, and you come up with your list of questions. And then you make another appointment and you review those questions, and you're always asking why and always getting the answers to your questions so that you get the very best care possible. So for my patients, at the end of every visit almost, but especially the new patient visit, I send everybody what I call a summary of today's visit. I talk about all the testing I've planned. I include relevant links for more information about the things that I'm recommending. And then I always invite patients to come back, make phone appointments, make video conference calls, anything and everything to keep the process going and get the path to pregnancy moving forward. So we're almost done with tonight's show. So if you're out there and you don't have a fertility doctor, you can certainly go to eggwhisperer.com. You can set up a telemedicine appointment with me. I'm not necessarily your local fertility doctor, but I can certainly feel like your local fertility doctor with all the different types of platforms that we have out there to communicate. I'd like you to get your levels checked, ask questions. Even if you want to use me as a starting point, I can send you to a fertility doctor that's close to you. You can also go to fertilitylifelines.com. You simply put in your zip code and you'll find a list of doctors, and then you can start meeting great people. I'd like to think that the work that we do is really great, just like me, who will do everything possible to help you reach your goals. So spend some time getting ahead of infertility and do what you can now. So I want to see if there are any questions. I'm going to log back into Facebook and see if I have any questions on Facebook. No. Great. And I don't think we have any callers tonight. That's totally okay. So next week, I have a special guest. He's a senior embryologist at a fabulous lab. And the topic is nuts, I did say nuts, and bolts of IVF. So we're going to talk about everything from ICSI, PICSI, assisted hatching, PGS, PGD. And if I just said a whole bunch of stuff and you're like, what? Don't worry, because we're going to break it down from A to Z when it comes to IVF, so that before you even agree or consent to doing these procedures, you actually know what they are. And if you have any questions, you can always email at eggwhisperer.com, and we'll be happy to answer your email live about nuts and bolts of IVF. We're here every Wednesday. We're also live on YouTube, and you can also follow me on my podcast as well. So if you don't have time to actually watch, you can listen to these shows during your commute or during your off time. So I hope you have a great night, and we'll see you here next Wednesday night.
Welcome to the Egg Whisperer Show, Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility Expert Dr.